Morning, everyone. We're going to get started in just a second. Let people join us. Pulled up for us. Okay. So it is 10 o'clock, so I'll go ahead and get started. Morning, everyone. Thank you so much for joining us today for our webinar, Creating School Health Community Partnerships to Improve the Lives of Children. Just a quick plug, if you are a tweeter, please join us at HMPRG and tweet hashtag ILACES, that's ILACES. Let us know what you think. My name is Madison Hammett. I'm a policy analyst with the Illinois ACEs Response Collaborative at Health and Medicine, and we are so excited to have Andrea Ortez of Partnership for Resilience join us today. For those of you who are joining us for the first time, Health and Medicine is an independent policy center based in Chicago that conducts research, educates, and collaborates with other groups to advocate for policies and impact health systems to improve the health status of all people. And this webinar in particular is presented by the Illinois ACEs Response Collaborative, housed here at Health and Medicine. We are a multidisciplinary group that utilizes the science of ACEs and childhood trauma in an effort to create critical transformation to policy and practice and align that with current research. The collaborative is a backbone organization, so we are a mobilizer, convener, advocate, and we all work to create systems-level change. So you can visit Health and Medicine's website for more information, and that includes things like policy briefs, environmental scans of trauma-informed programs, and you can also find all of our other webinars that we've held in the past, and hopefully sign up for our newsletter to get more updates about us. We are going to have some time at the end for questions, so please feel free to type in any questions or comments you have in that chat box you see on the side throughout the webinar. And then after the webinar, you're going to receive a short evaluation survey, ways you can participate more with the collaborative, links to our website with all of those items I talked about earlier, like the policy briefs and scans, and then you'll also receive a recording of the webinar. Finally, I am just so excited to introduce our speaker, Andrea Ortez. Ms. Ortez is the Southland Partnership Organizer with Partnership for Resilience. It's an organization that works to transform education, healthcare, and community organizations by integrating trauma-sensitive, family-focused systems of change. Prior to joining the partnership, Ms. Ortez worked on the southwest side of Chicago with the Southwest Organizing Project, SWAP. As the education director for them, she led the implementation of youth mentoring and programming for the organization, worked with 15 local schools, and directed the statewide Parent Mentor Program, a program model to increase parent engagement within public schools across the state of Illinois. And so I am going to hand over the reins to Andrea. I'm so excited, and we will get started. So, Andrea, you are now a presenter. There we go. We should see. Now we are looking at your screen, so great. Here we go. Oh, you started at the beginning again. Oh, we can. Give us just a sec, folks. All right, there we go. Right. Sorry about the delay, folks. Took a few seconds. Good morning, everyone. Thank you for the warm introduction, Madison. I'm excited to be here with you all this fine morning. So as Madison mentioned, my name is Andrea Ortez. I'm the Southland Partnership Organizer, and I'm tasked with really leading the work that we do with 9 school districts in the south suburbs of Chicago. I'm very excited to share with you all the work that we've been up to the last couple of years. I'll start off with just offering a breakdown of what we'll be discussing throughout the presentation, a little bit about the history of the Partnership for Resilience, how research around ACEs really was the initial catalyst and kickstarter to our work, coupled with trauma and brain research. Then I'll speak a little bit about how we strive to build trauma-sensitive schools and programs by focusing on health, parent engagement, and other key issue areas that schools have identified as the focus. To get us started, I thought I'd offer some information on how the Partnership for Resilience actually started. And so the Partnership for Resilience was born out of a very organic conversation that took place between 2 siblings, Audrey Soglin, who's the executive director of the Illinois Education Association, one of the key unions in the state of Illinois, and David Soglin, her brother, who's a lifetime pediatrician who was speaking to his sister about the ACEs research and at a family party. And throughout that exchange, Audrey was really impacted by how important it is for educators to understand this information to better equip their students to succeed holistically. And so from there, Audrey and David were really tasked with bringing together key leaders within their respective professions to a table and discuss, well, what are we charged with knowing this information, and what are we responsible for, and what impact can we have within our various systems and structures. And so from those initial conversations, the Partnership for Resilience was really born. And early on, they were tasked with also identifying, well, is there an area or a space that we can begin to cultivate this work in? And it really came down to where relationships existed. And so the Partnership for Resilience it has very key partners and relationships across the state of Illinois and beyond, right? Here is a list of our various partners. And for many, they saw the Southland, the south suburbs of Chicago, as a great opportunity to begin to cultivate this work. There were deep relationships with the school district through other efforts, and so the initial exploration of this work made sense for the Southland, also understanding the needs in the community. For those that aren't familiar with the south suburbs, this is an area that has seen drastic changes in the demographics in the last couple of decades, due in large part to housing insecurity within the city, poverty, and other social realities that have led to an increase in just vulnerable communities entering the area and looking for stability and growth, right? And schools are hubs for families and are spaces in which families look to for cultivating themselves and really establishing themselves in a community. And so it made sense that we begin to work with an area so close to the city, yet often neglected and often not given the proper resources to really provide the needs that their students and families are looking for. And so from there was born the partnership in the Southland. Our work is really tasked with transforming systems, building capacity, and establishing sustainable structures. And so I'll speak about that throughout the presentation. But I'll share really quickly, and I know this is a well-informed audience when it comes to ACEs, but just a quick refresher, because this is ultimately the research that impacted us and led us to start the work that we have been working on for the last few years. So we recognize the study that was conducted a few decades back that acknowledges the impact of ACEs and how these adverse childhood experiences can impact someone both behaviorally, physically, as well as mentally, and ultimately just the implications on the quality of life that someone may have as a result of adversity. And so we understand that there's extensive research now that informs the potential outcomes of having a large amount of adversity in one's life, and they've even expanded upon that list of what is considered adversity. But we know that there's a parallel now between the top 10 causes of death and the type of trauma and adversity that someone has experienced. If we couple that also with the brain research that has informed a lot of these professions, we understand that there are physical impacts to trauma and adversity. We understand that there are pathways that are compromised throughout the process and ultimately, again, impact the quality of life that someone can have throughout their life. We also know that we've expanded upon it and recognize that there are social conditions and social realities that often are an additional burden to many communities, understanding that there's historical trauma and a need to dive into these spaces more deeply to really understand how we can create the biggest impact. And so this is all information that we actually share with our leaders when we establish relationships with districts, where we want them to be aware of the research that can inform our work and that ultimately build the connections to what many of them are finding within the classroom. And so we understand that adversity, there are signs already even before a child starts formal education. And so recognizing that and understanding the developmental impacts of that, as well as the then academic implications of living with those vulnerabilities and understanding that these challenges are present within the classroom and a day-to-day reality for many students. So with our work, we really strive to focus on the story behind the misbehavior. For us, you'll often hear associated with this work, it's not what's wrong with this child, but what has happened to this child. And I think for us and the various partners that we work with, it's even working beyond that and saying what systems and spaces can we influence that will ultimately prevent this from happening in the first place. And so it's really tasking ourselves with meeting the needs of the whole child and operating out of frameworks and philosophies that have existed for a substantial period of time. But really connecting the dots and creating the space for practicing these philosophies and exercising what these systems can look like. So if you look at this image, there's a lot of components within here that we strive to incorporate into our work with the Partnership for Resilience, but it's with an understanding that this is the general direction that we want to move all our work in. So we work a lot with educators and within the school system, and a lot of the philosophies that we bring to the table include those of Dr. Joseph Murphy, who really focuses on academic press and social-emotional learning. And so we work with our educators to explore those realms and to understand that in order for children to truly be successful, there have to be systems and norms that focus on care, support, safety, and membership, and how those ultimately allow for the academic learning outcomes that we're striving for, but also prioritizing the social learning outcomes that ensure that a child is holistically being cared for and fostering an overall healthy young adult. And so our work has taken a variety of forms early on. Because of the key partners that we've had, we've been able to bring a strong health component to our work. And initially, there were a lot of conversations with schools and school district leaders to really wrap our minds around, well, what is necessary and how can health and educational institutions work together to really stand behind their students. And early on, the initial key areas of focus for health work were identified with an emphasis on responding to the needs within schools, but understanding that the priority and the direction that this should really go in is to create connections to a patient-centered medical home. And so that's still a large motivation for our work.
We strive to build those strong relationships with key institutions already in the community. And in order to do that, there first needs to be an intentional collaboration and an establishment of a collaboration between health systems and schools so that they can work together and develop programs. And in order to do that more successfully, we understood that coupled with educators being informed on ACEs and the impact of trauma, medical providers could also benefit from that understanding of our work. And so we put our health work technically has two buckets, although our efforts are to address it as a whole. And so we're not separating physical from mental health per se. We do meet on this collectively, but just to give you a sense, we have various partners that are working with us on our physical health work as well as our mental health work within schools. And these are initiatives that take varying forms depending on the district and their specific needs. And so we're very intentional with our school districts to not have them feel like it is a cookie cutter solution to every district, but instead we want them to establish conversations that allow for them to really engage with this work and explore how best we can bring these services to their specific setting. To give you a sense of how we structure that, I'll share a little bit about how we establish relationships within the districts. And so we are tasked with initially cultivating resilience teams within each school district, and these are comprised usually of administrators, social workers, teaching staff, et cetera, who are interested in how do we prioritize building a trauma-sensitive school district. And these teams build action plans at the beginning of the year that allow them to focus on what key areas they want to do this work in. Some of them choose physical health, others may choose mental health, others may choose family engagement. But early on, the initial work is really focused on building a foundation around understanding adversity and trauma and ensuring that every single staff person is knowledgeable on the direction that the district wants to move in and sees every single one of these components as one that is in alignment with moving towards becoming a trauma-sensitive district. And so we have on our website an early lessons learned document that speaks about what that initial process looked like for the Partnership for Resilience and how we established these resilience teams, as well as how we pushed our health work forward as an initial opportunity, considering the relationships that we've been able to build with providers. And so this infographic is actually pulled from that early lessons document that you can find online, and speaks to a couple of the initial findings with the partnership. As I mentioned, there are multiple ways in which our health work has kind of been brought to life within our districts. I'll share quickly with Calumet Park, which is located about 20 minutes south of the city. This is a smaller school district. It's only three schools are part of this district. And initially we had done some dental van screenings or care with students, and through the Mobile Care Chicago program. And so this district has adopted more of a mobile approach to working with health providers, and it's due in large part to the lack of health institutions in the area that are equipped to meet the needs of these families. And so this is a district that has benefited from a more mobile structure, but we are striving to still connect them to medical homes. With the initial dental work, we had the first year a screening that took place with over 200 students, and as you can see from this data, more than 50% of them needed some type of treatment. And the great part about Mobile Care Chicago, one of many, is that they not only do the initial screening, but they also do the follow-up care and the restorative care. And so they were able to help with the treatment that was identified. And as you can see, of those 111 individuals that needed follow-up care, there were 356 fillings that were conducted, as well as 41 extractions, 21 crowns, etc. And so this is just an indication of how high the need has been. We're happy to say that the numbers have not been as shocking as we've continued to offer this care and built this relationship with the districts. But this is a school district that serves preschool through 8th grade, and so these are young children that are experiencing a lot of pain when it comes to their oral health, and it's an indication of the need for these types of services for them to be successful within school. Our Early Lessons Learned document dives in deeper into Calumet and really the larger findings there, but it is a structure that it is a district where we've been able to bring a mobile care structure that brings asthma, dental, vision, and physicals and immunizations to the district. And we've even been able to execute a universal consent form within that district. This was the first district to do that, and now we've been able to branch it out into a few other districts, but we're happy with what we've been able to accomplish at Calumet. Another example of how our health work has taken place is in Fort Heights. This is also a smaller school district with 2 schools, but a benefit that the Fort Heights community has is that there is a Cook County Health and Hospitals clinic in the area, the Cottage Grove Clinic, and this has allowed us to connect students directly to a medical home and cultivate a relationship between the school and the clinic that allows for the students to be served effectively. The clinic and the school district are actually steps away from each other, but prior to the Partnership for Resilience being established, there was no formal relationship or partnership with the clinic, and so we're really excited that we've been able to foster that relationship. And these are examples of 2 districts that meet with their providers on a monthly basis, are able to really invest in the process, address the challenges and hurdles that come in creating these collaborations and working beyond that. I think we've been very intentional about bringing to the table providers and districts that are ready to roll up their sleeves and do this work. And these are 2 examples of how we've been able to do that successfully, even if the approach has had to be somewhat different with the mobile care versus the connection to the medical home. And so that gives you an understanding of some of those structures that we have. Here are some additional early lessons learned from our health collaborations, and I'll just highlight a few of them. Just the need to really invest time in strategic planning was something that we learned and have prioritized early on in our work. We take the time to really align ourselves with our partners and make sure that everybody is on the same page and shares common motivations. We understand that leadership support is critical, especially within large systems such as school districts or large health systems. We want to establish the proper buy-in with these institutions and ensure that the right people are at the table joining us in these efforts. And so a lot of our work really focuses on building relationships and sustaining them. I know Madison shared a little bit about my background. Ultimately, my background is in community organizing, and I think my ability to work with key leaders and really identify what their self-interest is and move towards a common vision is all done through a relationship lens. And so being able to ask institutions that feel the strain of the communities that they work in and understand that there is a high need for these levels of support in order to really ask people to go beyond the call of duty is there needs to be a personal connection and a sense of we're here to do what's right. And I think by building relationships, we're able to foster that value. In addition, and I know this recording will be shared with you all, and that will give you all some time to take a look at all of this in more depth. But it's work that what has to happen behind the scenes in order to really cultivate this is to identify the strengths and needs of districts and partners, right? And so being really honest and saying, we can provide these services, but we'll need to identify additional funding, and the collective tasking themselves with figuring that out and not seeing it as solely a provider's issue, right? Or on the reverse end for our schools, recognizing that the need is to get consent from the parents and ensuring that parents are part of the process and seen as key, as a valuable asset to this collaboration. And so how do we work with the schools to build those positive relationships and to ensure that their needs are also being met? I will also share that there's a significant value in recognizing that small victories make a big difference. Small wins are the spaces in which various leaders around the table can begin to see and witness what their efforts have produced, right? And it keeps the momentum going. It keeps people feeling like their work is being valued as well as in alignment with the needs, right? And so it's being able to identify those small wins and recognizing that they matter and creating a culture within the team that allows people to celebrate those small wins. This is all critical to ensuring that those partnerships are sustained over a long period of time. And again, I'll echo, these are partners that meet with school districts on a monthly basis. And so throughout those conversations are when we're able to check in and really see what are ways in which we have succeeded, what are ways in which we can continue to grow and continue to improve. The next piece that I will discuss really emphasizes some of the efforts that we've been able to establish in the last year or so after I was able to join the Partnership for Resilience. And so I do come from a background with some knowledge on parent engagement, and this is a key pillar to really establishing trauma-sensitive institutions is how you engage families and understand that parents and families play a big role in the success of their child within school. And so we explore with the various districts what are the varying ways in which they want to engage with families and how do we do this in a sustainable and meaningful way. And I will share, I think for many schools, this can be a huge challenge. There's hesitancy and concern around how this will take place, if it will lead to more work, and really trying to see, well, what is the benefit of embarking in this process and engaging with family more thoughtfully. And so early on, I think I'm tasked with really establishing the teams that will take this on in spite of the challenges and understands the value. And so I often look at these conditions for family engagement, which focus on it should always be something that's linked to what is taking place within the school, right? It shouldn't be removed from what the educator's top responsibility is. And again, it echoes similar philosophies from everything else that we do in our work, which is that it should be relational, right? We should feel like our relationships with parents are ones that are intended to move towards collaboration, where we recognize that parents bring assets and strengths to our school community. And we work to really bring out the best in everybody, right? And recognize that it's an ongoing development and it's something that will take time. But if we stay energized and enthusiastic about it, we can see the end result of a school or district that is dynamic in the way in which it's able to engage with students and ultimately impact their lives and the lives of their families. And so Karen Mapp has done a lot of research around this, and I like her 5 approaches to doing this. And so a lot of our work right now is recognizing that we've done a lot in building a foundation with educators and with school districts, and then we've also been able to bring to the table key health providers and partners. How now do we branch out and ensure that all stakeholders in these communities are being brought to the table? And in large part, when it comes to schools, this includes parents and guardians. The next slide is really my approach to engaging with families and the various stages to that process. Often I'll have school leaders tell me, well, we'll get 200 parents to a winter rehearsal, and that's great. But when we try to do a curriculum night, we're lucky if we get 10 parents. Why is there such a contrast? And I think often schools think that they can jump from this, what I refer to as the fun stage when it comes to family engagement, where parents are encouraged to come to those winter rehearsals, those football games, the events where they get to celebrate their child, which are meaningful and ultimately are part of the school culture. But at the same time, they want to leap to having parents engaged around their child's education and understanding how to navigate through that educational system when parents often don't have the tools or resources or the understanding of how to do that. And so my experience has led me to really focus on the valued stage, what's at the middle of this slide, which is an emphasis on welcoming and intentionally welcoming parents to the school and creating a culture where parents see themselves as a valued asset within their child's education. This is a stage that requires a reaching out by the school to the parents and an invitation to sit down with parents and to really explore with them what are ways in which they can proactively engage within their child's education and ultimately contribute to the larger school community. Many parents have also had negative experiences within the school themselves, and so this often becomes a barrier to them knowing how to navigate the best way to provide support for their child. But it is clear to me that there is no parent or guardian that does not want good for the child or their child. And so it is reminding school districts and partners that parents need to be seen through that lens and that there is value in beginning to cultivate relationships with them in a meaningful way. And so a lot of our work these days is focused on investing in that valued stage and walking with districts throughout that process. I think often schools are expected to engage around bringing family and community into the space, but it's not often a space where all schools feel comfortable in navigating. And so I think we're able to establish leadership and really build capacity within the districts with all of our efforts and all of our programs to begin to chisel away at things that people recognize or components that people recognize are important to really produce a successful learning environment, but may require more time or energy to truly cultivate and sustain. Again, I'll reference our early lessons learned document, which can be found online, that has really spoken to the ways in which we've built trauma-sensitive systems, how we've connected school and community partnerships, and how we've linked health services to our work. I think it's an initial start, an initial summary into what we've been able to cultivate, but the process is ongoing. For us, our work continues to grow. Initially with the Partnership for Resilience, we started with 3 school districts, and we've now jumped up to 9 school districts. And so there's really been some buy-in in the Southland. We've 8 of those 9 school districts are K through 8th grade. We also have a high school district that had come on board in large part because their teaching staff was really motivated to see this work, and they have explored what this can look like for a high school setting. But ultimately, for all of our districts, it's a significant motivation to see the needs of their students being met holistically, and a recognition that educators are in a position to create these varying levels of support for their students. And we are lucky to be working with 9 school districts that have committed themselves to really fostering the space to think through this and to embrace those small wins, with the motivation to work beyond that and ultimately see this work grow and be a transformative cultural shift within the world of education and health. With that, I will open it up to so here is my contact information. It will also be provided at in a future slide, but we can open it up to a Q&A discussion if anybody has any questions. Ultimately, I like to create some time to make sure that specific questions for our audience are being met, or are being answered.
Thank you so much, Andrea. That was so great. And we actually have already gotten some questions in, so I'm going to get us started off. The first one, and this is a question I also have, just how did you all go about building those trauma-informed systems? And within that, how did you do things like assess readiness? How did you advocate? What was, I guess, sort of the process for getting people, invested in it initially, and then invested to sustain it and keep it going?
Yeah, that's a really great question, and I think through our work, we've been able to find effective ways. So I mentioned how early on the Illinois Education Association was involved with the Partnership for Resilience and continues to be involved. We also have the IFT, the Illinois Federation for Teachers, which is the other union in Illinois, also very a key partner in our work. And so I mentioned that because I think what we've learned is there needs to be an investment in really bringing key leadership to the table and making sure that they're all on the same page. And so that includes union leadership, that includes administrative leadership, teaching staff, supportive staff, so that includes social workers and nurses, and that's really how our resilience teams are comprised. And so early on, when a district indicates that they are interested in joining the Partnership for Resilience, we will engage in a conversation with them around it, but we want to be reassured that various leadership positions are on board and motivated to do this work. Because throughout the year, there are various touch points in which we meet with the union teams or the administrative teams and have reminder conversations on the key ways in which they play a distinctive role in pushing this work forward. And so it becomes really difficult to change the culture of a school district if all leadership is not on the same page. So that is kind of a requirement from the beginning. And then there has to be some investment in the beginning, especially with the ACEs training and trauma-sensitive school training that we conduct in the summer. And so we invite districts that are interested in joining the partnership to begin to form this resilience team that should have varying roles and responsibilities within the district to come to the table and to begin to dive deeper into ACEs and trauma and brain research and how education can cultivate the space to meet these needs. And but it starts with a base of knowledge that has to be shared. And so there has to be an investment in attending those trainings, and from that point, establishing an action plan that allows for the team to determine a focus. But I would say to answer your question in terms of kind of that initial component that we're looking for investment from leadership in a meaningful and substantial way. Many of our school districts have their superintendent on their resilience teams, right? And that plays, or that is a huge asset to our work, because that allows for honest decision making to take place. But it's not limited to the superintendent. It's how do you cultivate a team of leadership that is working cohesively and moving in the same direction.
Great, thank you so much. And then this is building upon that a little bit within this building process and determining relationships and stuff. How have you, if you have, worked with competing relationships within communities, things like school-based health centers versus health departments, or is that an issue? How is it that Partnership for Resilience is really bringing folks together in terms of aligning everyone's interests and needs?
Yeah, and I mentioned this a couple of times in the presentation, how much we focus on building relationships. I think for us, we have so much wealth and so many assets within our core partners with the Partnership for Resilience. And so early on, the partnership operated out of really bringing consultants and individuals that were experts and continue to be experts in their respective fields. And so we have a health consultant that has had years of experience when it comes to building school-based health clinics, as well as connecting providers with school networks. And so I think there's a level of expertise that has informed the type of partnerships that we've built, both within or with healthcare providers as well as within the world of education. So I think it comes down to connecting with partners that want to work beyond the challenges that present themselves, right? That are willing to collaborate authentically and build genuine relationships and have a deep investment. So the same way that we're expecting leadership within school districts to be all in, that's the same philosophy that we approach our providers and our partners with. And that's allowed us to accomplish those small victories that then have now snowballed into much larger ones. But we want to make sure that we are bringing people that are ready to get the work done. And it's not an easy process, because you have to be really honest. And there are certain times in which you recognize that where an institution is at may not be ideal yet for this type of work and for really cultivating a trauma-sensitive institution. But that doesn't mean that we just say, all right, come back next year. We provide them with practical ways in which they can work on what needs to take place, build a stronger relationship between the union and the administration, for example, or giving them time to identify ways in which they can sustain what they're currently doing so that they can sign up for something additional. So at the end of the day, we want to be working with institutions that have the stability to take on some of the challenges that we know these communities face on a day-to-day basis, but we want to find practical solutions to those and meet those needs. So the types of providers and partners needs to be ones that are ready to do that at all fronts.
Great. And we have a couple of questions about specific partners and if you've engaged them and how that went. So I'll start with this first one. Have you done any work in preschools or outside of the K through 12 system? And I know you talked about ACEs, so that's a really critical stage of development. And wondering if you've done any work around that.
Great question. So we actually are in the midst of our own strategic planning process, and a big question that has come to, or a big component that has been part of our conversation is the opportunities that can present themselves in 0 to 3 programs and spaces. And so I think there's a significant interest. We're still kind of trying to figure out, well, what is our role within that, and is there capacity to really impact and collaborate with those spaces in a more meaningful way. So I think the interest is there, and we're able to see the parallels and the need. but we want to make sure that we are staying true to how we approach things and really planning things out before signing up for too much. We also have been in conversation with Governor State University, whose president, Dr. Maiman, has begun to explore, well, what does a trauma-sensitive school structure look like for higher education and for a university setting? So on both ends, there's interest, but we continue to explore, well, what is the role of the partnership within that work?
Great. And then another question about individual members. Have you included any local healthcare providers on an individual level, such as private practice, pediatricians, and how do you bring those individuals on in the same way you would bring an organization on, if so?
So we haven't, and I think that I'd be, to whoever asked that question, feel free to send me an email. I'd be interested in talking to you in person or over the phone. And I think for us, we're a fairly young organization. I'm the only full-time staff person, and so a big part of what we're tasked with right now is capacity and sustainability. And so I think we want to continue to operate out of a framework that is relevant and impactful for the work that we're striving to do. And I think the more partners that are interested and at a level to invest in this work, I think that only strengthens our growth and our capacity. But we have not explored that realm yet, in all honesty. And so, but I think there's definitely opportunities to collaborate to some extent. So,
and then we have another one about individual fields. Have any of the schools incorporated after-school programs as partners? And they talk a little bit about their after-school program, that they're working with the same kids who are being seen by school social workers and administrators already. And so what extensions beyond the school day, if any, have y'all made?
So there are ways in which we've collaborated with after-school programming. Again, there are consultants that we've been working with throughout this process that have informed us on best practices when it comes to out-of-school time as well. And so I think our approaches and techniques have echoed what is possible within out-of-school time, and definitely align with that, because these then may be students that instead of only spending 8 hours at school, they're spending 12 hours at school, right? Or spending a significantly larger amount. And so with our trainings and the work that we do, specifically around classroom strategies and our approaches in that space, we do talk about what can take place in the summer and what can take place after school to continue to foster the social and emotional skills that students need to cultivate. But to partner specifically with after-school programs, and I'm curious if this is someone within a larger system like CPS, because my experience in the South Suburbs has been that after-school programming is either conducted by park districts in the area or by the school district themselves. So they've chosen to expand upon what they already do throughout the school day. And so there aren't as many specific partners that are executing these after-school programs. And so I'd be open to engaging in those conversations and imagining ways in which we can collaborate in those spaces as well.
Thank you. And then we have a question about the school districts and if they had incorporated any social and emotional learning in tandem with your program.
Yeah.
And if so, how was SEL built upon so the school didn't feel like they had to start over or learn a whole bunch of new stuff over and over again?
Yeah, great question. And I think it's something that we come across often with our work, and that's really once we have built that foundation with the school districts around ACEs and understanding that we have to that there has to be a mindset shift in terms of how we're engaging with students. That comes next, right? What strategies can we incorporate in the classroom? How can we build structures or echo the same message and that shift in culture throughout the structure of our building, as well as how can we work with policies and standards that are already implemented that align themselves. I think right now we're at a pivotal point when it comes to engaging social-emotional learning and doing it well. We have other efforts that align with this SB 100 as well as ESSA, right? And so how do we kind of bring all of these structures together? It's crazy to think that social-emotional standards were, or within Illinois was one of the first states to develop social-emotional standards back in 2004. And for many educators, we continue to be an introduction and a diving deep into social-emotional standards and really equipping educators with how you can engage in these social-emotional standards in conjunction with the academic standards and not see them separate from each other. And so I think that's been really impactful work that we've been able to provide teachers that are motivated to do this and to do it well, but may have not been trained formally on how to execute it in a meaningful way, and initially feel overwhelmed, feel like in order to juggle both set of standards, they have to do twice the work. So a lot of our work is how do you connect the social-emotional standards to the academic ones so that they can be executed simultaneously. And I think overall our educators have been really open and motivated by this approach and see it as accessible and are excited that after over 10 years of the standards existing, they see themselves actually practicing them within the classroom and are beginning to see how much of a greater impact incorporating them has had, especially with students that are in need of those skills because that might be the only space that they are engaging with these skills in, and recognize that their students excel more with the academic standards when they are coupled with social-emotional standards.
And this next one, I'm combining two of our questions, so it's a little bit lengthy, but they're very related. So are you also charged with finding the most suitable parenting education programs? What programs are being used in your schools to help prevent ACEs from occurring to begin with? But then related to that, what ways are you utilizing the assets those parents bring, whether they be individual or cultural, their knowledge, and how are you using that to enhance your program?
Yeah. So when it comes to programs that we're working with, both the Parent Mentor Program, which I have some history with, this is a program that works to focus on parent engagement, but also leadership development. And so this program really focuses on how do you support a parent as they navigate through supporting their child within the system of education. And then we also have the Triple P program, which is a program that offers more structured parent education and has a curriculum for various stages in a child's life. I think the challenge that we often face is there is a high involvement of parent engagement at the initial start of formal schooling. So you have pre-K programs that have requirements for parents, and that allows for that structure to be sustained throughout that school year, but then kind of drops off as the child gets older. And so for us, in large part, we're working with districts to bring that structure and spread it beyond their pre-K programs in a way that allows for no gaps to exist and for parents to feel like there's a continued expectation for the role that I play within the school. And when it comes to really identifying parents' assets and utilizing them within the school, I think we very quickly, in a 20 to 30-minute conversation with parents, you can ask key questions that will allow you to understand, well, what does this person do professionally? How do they de-stress? What brings them joy in life? And by asking these questions, which ultimately are very human, you're able to understand or get a sense as to how this person can contribute to your larger society in ways you couldn't have even imagined. I'll offer an example. Recently with one of our schools, we did a relational building campaign with parents, and the principal and assistant principal committed themselves to having relational meetings with a group of parents that teachers had recommended they saw potential in these parents being more involved within the school. And time again, these parents were communicating that they didn't know why they were being invited to this, and but at the same time, they didn't know what they could bring, what strengths they could bring. And so as we ask them these questions, you learn which is the parent that taught themselves English in the last 6 months, which is the parent that enjoys studying science with his daughter, and that's how they bond on the weekends, right? Or what are the parents that really truly have begun to see or to feel like they don't have a value to bring to their child's education? And so when you begin to engage in those relationships with folks, you begin to see ways in which they can be an asset to the school. So how do you invite the parent that enjoys science to be more involved with the garden you've been trying to kickstart at the school, right? And learning that he can be a great asset to that space. Or how does the parent that has begun to see value in this specific school, it has a large immigrant community, and so if they have taught themselves English and begun to see that value, how can they start a ESL program for other parents in the neighborhood, but it be a parent-led initiative? And so I think beginning to see various opportunities within the school structure that allows for parents to be more involved and to be the leads, I think is a great start, and that starts with taking the plunge and just asking parents who they are and what brings them joy in life. So those are some examples as to how we strive to kind of shift that approach to engaging with families.
Great. And then you talked about assessing folks for readiness to join the program, and we have a couple of people who have asked, how do you quantify success once you've started the program? And we have folks asking on an individual level with things they're doing in their own environment, like stress reduction or measuring the tenacity of students in the face of adversity. So what are y'all doing to measure success within the program?
I think this is an ongoing process for us. We recently, one of our partners is the Harvard Graduate School of Education, specifically the Education Redesign Lab, and we're part of that cohort that is called By All Means. And this has been an opportunity for us to really dive deeper into telling our story and beginning to capture our successes and wins, and establish those qualitative and quantitative metrics that inform what we've been able to accomplish. I think for us, our evaluation process is still one that is being developed. We do not go into the districts trying to come in and determine how many ACEs each child has experienced. That's not our philosophy. For us, we understand that trauma and adversity exists in any group of human beings. And if you are if you begin to share and incorporate systems of support that align with meeting the needs of the whole child, it will benefit all students. And so a lot of our work has focused on Tier 1 support, but as our work has continued to grow, we're diving deeper into Tier 3, Tier 2 levels of support. And I think within all of that, we're then asked to identify in more depth those metrics. So it's an ongoing process. We do have a rubric that we use for our districts to self-assess and to determine where they fall in various components related to building a trauma-sensitive school district. We also have a teacher belief survey, which allows us to really capture how the mindset of educators has has shifted throughout this process, and what are ways in which we can continue to provide support to educators so that they feel like they are cared for throughout this process. And I will do a quick mention to something that was born out of beginning this work is even the focus on staff self-care, right? And the importance of ensuring that as staff dives deeper into adversity and trauma that their students may be experiencing, that might trigger their own experiences and things that they have dealt with. And so how do we also ensure that staff is cared for throughout this process? And so I'm sharing all of this to say that all of these components have forced us to explore in more depth, okay, what are these universal ways in which we can measure success and evaluate our growth and our accomplishments. So check out the early lessons learned document. I think there's some there, but stay tuned. I think we're excited to hopefully have something in the pipeline in the future that could better explain what we've been able to accomplish.
Great. And I'm going to close us out with one final question. We have several folks from all different types of sectors asking how they can get involved or how they can join the partnership.
Yeah.
And so what are some ways that folks, if they're interested in starting at their own organization, can?
Yeah. So again, I'm a community organizer or historically, and so I enjoy the relational work. I enjoy sitting down with people one-to-one. Any inquiries that come through our website come directly to me and another colleague, and so feel free to check out our website and to ask any questions or additional questions you might have through there, as well as I think we'll show again my email address, so feel free to email me directly. And we are, many of us are based in the city or in neighboring areas, and so I think just opportunities for us to collaborate are always welcome.
Great. So we are going to close out. Thank you so much. This was great, and thank you to everyone who joined us for an amazing Q&A session. If we weren't able to get to your question, please feel free to reach out to us, and I'm happy to pass it along. Just a quick plug for next time in March on the 28th at 10, we will be joined by the TheraPlay Institute. They'll be discussing the role of play in preventing and responding to trauma, as well as how organizations can utilize play therapy to serve their community. So when you get your follow-up email from me about this webinar, you will receive a link to register for our March one, and we hope you'll be able to join us. Andrea, thank you so much.
Thank you all.
Here is all of our contact information. Please follow us on Twitter, sign up for our newsletter, and thank you again for joining us.